hope people can hear this because this is not playing with the speaker of their audio jack. So my talk would be on the ergonomics part. I'll be just playing one small video, and with that I think I'd be wrapping up my talk. I hope it's heard.
Hello everyone.
Is it heard?
Ophthalmic surgeon. All's well, but then
Anything is heard?
my back. क्या आपके पीठ में दर्द है? क्या आप ergonomics जानते हैं?
Ergonomics?
Hereby presenting a neglected story of MSD. Oops, the musculoskeletal disorder of an ophthalmologist. According to a national survey, more than 70% of ophthalmologists reported back pain. Why is it so? Let's have a look at a routine day of an ophthalmologist. Be it indirect ophthalmoscopy, assisting OR, slit lamp examination, or long surgeries. We are taught how to examine a patient to his best, but unfortunately, good ergonomic practices are not taught to us during professional training, neither is emphasized during the clinical practice. Reported prevalence of musculoskeletal disorders among ophthalmologists in India ranges from 50 to 80%. Ophthalmic clinical practice mostly involves repetitive tasks with fine motor control and close visual focus, which increases muscular tension in head and neck. Maintaining awkward posture for long hours may be another contributing factor too. Ophthalmologists in the 21st century are equipped with an armamentarium of ophthalmic devices which aid in diagnosis and management. However, if these are not used in ergonomically sound manner, they may paradoxically harm the ophthalmologist rather than benefiting them. Remember, machines and equipments are made to ease our work and not vice versa. So my friends, let's not take a chance. Let's make a change. Let's place the ergonomics as fitting the workplace to the worker and not the other way round. Let's bring a harmony between the man and machine. In our OPD, slit lamps are more patient-centric when in fact each patient just ends up spending hardly 2 minutes for his examination, whereas the doctor spends 4 to 5 hours of his day on the same. The slit lamp are pointed more towards the patient, putting a stress on doctor's back. Rather, shifting the slit lamp towards the doctor and adjusting as shown in this video can put the spine at 5. Additionally, adjusting the height of the chair, be it of the patient in the OPD or the surgeon in the OR, takes a prominent step. With the newer surgical chairs, the surgeon has an option to have his own ergonomic profile setting in his surgical chair. Now that the surgeon's chair is set, the next key would be to adjust the height of the patient's bed and the microscope to fit the ergonomics. Newer microscopes with longer horizontal optical paths helps us to avoid hunch of the back and neck. The advent of ocular 3D design 3D visualizing surgical system has been a game changer in ophthalmic ergonomics by improving surgeon posture and hence by reducing unwarranted muscle fatigue. An assisting surgeon also needs assistance with ergonomics. Shoulder area cutout on patient bed helps for temporal surgeries and allows easy access and additional legroom for assisting surgeon without compromising the patient comfort. All said and done, man behind the machine is important too. AIO has recommended yoga sequences tailored for ophthalmologists which can be referred. Stretch exercises between long surgeries are helpful to avoid muscle fatigue. It is truly said, a little help goes a long way. Back strengthening exercises and swimming helps to keep our core muscles strong and prevents fatigue on long run. Unfortunately, God hasn't gifted with the power to age back like Benjamin Button. So my friends, back your back and it will back your future on a long run.
So with this, I would like to thank Chaitra ma'am, Jyoti ma'am. This was an internal IC instruction course with three of us being speaking to each other. But thank you for being with me every year with this IC. It's a real wonderful moment. Can we just have one small pic before we